This is a 360 grade for my environment. Okay, now let's start. Hello, hi, knock knock. My name is Mary. I'm going to be your nurse today. Can you please tell me what is your name and date of birth?
Maria Duran.
Then what is your date of birth?
6.
Sorry.
June 6, 52.
Okay, so let me wash my hands and close the curtains for more privacy. Now I'm going to explain you what I'm here today. I'm going to be doing a head to toe assessment of your health. It's going to take 15 minutes, so let me know if you have any questions in the meantime.
Okay.
I'm going to be checking for your level of consciousness. Can you please tell me where you are at now?
In the hospital.
In the hospital. And can you tell me who is the president of the United States?
Biden.
Okay. And what day is today?
Wednesday.
Okay. So my patient is alert. Her speech is proper for the conversation, and she looks not clean and neat. Now I'm gonna be doing a head assessment. If you allow me, I'm gonna be touching your scalp to check for any parasites or infestation, any alopecia, any masses, indentations, any bruises, if you feel any pain. Okay, and it's good. So also I'm gonna be checking for your face. Your face is nice and pink. Your eyes and nose are according to your body. Also, there is no drooping on the side, and your eyes are not twitching. Let me also check for cranial nerve number 7 and cranial nerve number 5. 7 has to do with your facial expression. Can you smile for me? Can you open your eyes and close them up? Okay. Can you pop up your cheeks? Can you frown? Okay. Okay. And that cranial nerve number 7 is also intact. Now I'm gonna be checking for number 5, which has to do with mastication. Let me check the temporal bone. Same time. Can you clench your teeth? Okay. Can you try to open against resistance? Okay. And that cranial nerve number 5 is also intact. Let me check here when I'm here for your frontal, your maxillar, and your frontal. Does it hurt? Does it hurt? Okay, perfect. So I'm going to check for your eyes. I'm gonna see that your eyebrows are okay, your eyelid also okay. Can you look up? Okay, your sclera is white and shining, your eyes are round, there is no discharges, redness, or anything that it shows that they have any abnormality. I'm going to be also checking your cranial nerve number 2 with your vision. Here is a Snellen chart. You are 20 feet apart. Can you read this line?
Yes.
Okay, perfect. Now that confirmed that cranial is intact, but also gonna confirm it with doing a peripheral vision. Can you close your eye? Can you see?
Yes.
Can you close other eye? Can you see? Okay, perfect. Now I'm going to check for cranial nerve 3, 4, and 6 with a 6 cardinal gaze. Let me turn on. Let me do. You're gonna look into this. Look over here, and you're gonna follow my pen. Okay, there's no strange movement. Now you're gonna follow here to see how they accommodate, and I'm gonna check now the constriction. Okay, and that confirming perla, your pupils are equal and round, and they are reactive to light. And that, like I said, confirming cranial nerve number 3, 4, and cranial nerve number 6. Now I'm gonna be checking for your nose. Your nose is in the middle. See, there is no discharges, redness, or excesses. It's the middle of your face. Can you close your? I'm gonna check for your patency, your snare patency. Close the other nostril for me. Perfect. Can you smell this for me?
Yes.
Lavender. Okay, perfect. And that's cranial nerve number 1. Now I'm gonna check for your ears. The tympanic area is nice, clean. There is no excesses of serum. There is no discharges. There is no tenderness here in the spina. Do you feel any pain? Okay, here in the tragus, does feel any pain. Mastoid process here, there is no any pain. Let's do the same thing on this side. There is no excesses, discharges, or redness. There's no any pain,
No.
any pain.
Yep.
Okay, so can you occlude one of your ears? Can you tell me what I say?
Apple.
Can you close the other one? Can you tell me what I said?
Apple.
Perfect. And that confirming that cranial nerve number 8 is also intact. When I'm here, I'm also check for your limbs before I do the mouth. This is your submental, your submandibular, your tonsillar, preocular, postocular, your occipital. This is here your deep cervical, the cervical chain, your posterior chain, cervical, and your subclavicular. Okay, and there is not any nodules. No. Okay, now let's do your mouth. Your lips are pink. There is no crackles or cold sores. Can you open? And they're pink. Let me check for this. Okay, can you say ah? Okay, that's cranial nerve. Okay, your ulus in the middle is present. The tonsils are there. Number 1. There's no discoloration or redness on the side. You have all your teeth in there. There's no caries. Your gums are also nice. Your tongue is pink, and there's no dryness in there. Okay. Can you put your tongue out for me? Can you move it to the side? Onto the other side? Okay, and that's cranial nerve number 12, also intact. 9, 10, and 12 are verifying here also with swallowing. Can you swallow for me? Okay. Okay, now that I'm here, let me check here. Your trachea is in the middle. You are swallowing correctly. Okay, I'm gonna take the opportunity now to hear your carotid artery. Let me palpate first, one at a time. Palpate one at a time. Let me hear it with the bell. Can you hold it for me? Breathe and hold it. Okay? Breathe and hold it. There is no bruits and in your tracheal area. There is no abnormal sounds either. Okay? Now that I finalized, let me do for the neck. Can you look on the other side? Look to the other side. Can you look up? Can you look down? Perfect. So can you shrug your shoulder for me? Okay, can you do against resistance? And that confirming the cranial nerve number 11 is also intact. Okay, now I'm gonna do the chest. Your chest looks good. In the anterior and the posterior area, it looks the same side. There is no funnel or barrel chest, meaning that you don't have a COPD or you have any inability to breathe correctly. Let me start by hearing your lung sounds in the front. So the A points, but in the anterior position, your chest is divided in 2 lobes. This side has 3 and this side has 2. Let me start. 1. Can you breathe in and out? 2. In and out. 3, 4, 5, 6. 7, breathe in and out. 8. Okay. Now there's 2 under the armpit area. 1. And you breathe in and out. In and out. Okay. And there is no abnormal sounds. There is no crackles. There is no wheezing. Breathe in and out. Okay. Can you look at the other side and the back? Okay. Like only I heard vesicular sounds, a bronchial sound, which is what we want to hear. Now your back is nice. That have no lesions. The colon is proper. Your colon is straight, showing that you don't have presence of any lordosis or scoliosis that can go against your breathing process. Are you hearing okay? Okay. Are you breathing okay? You having any cough? No.
No.
Any chest pain? No. Okay, you are breathing rhythmically. So let me hear this. Also a sign from the apex. Breathe in and out. 1, 2. Breathe in and out. 3, 4, 5, 6, 7, 8. In and out. I'm gonna check for your breathing expansion here. Breathe in and out. Okay, they're symmetrical. There's no, there are both, and when she breathes on the same side. Here, when I'm here, I'm gonna be checking your CVA, which is your costovertebral angle. There's no tenderness. There is no pain. Also, I'm gonna do your fremetos, tactile fremetos. Can you say 99?
99.
99?
99.
99.
99.
Okay, and this completes also the back. You don't have through here. I don't hear any wheezing, crackle, striders, or any abnormal sounds. Let me do now when I'm here the check for your heart sounds.
Okay.
Okay, and the second intercostal space, and the external border, I'm gonna hear the aortic. Here on the other side, which is the pulmonic, and the aortic, I hear S2. Here in the second intercostal space on the right, on the left side, I can external border, I hear the pulmonic. And then in the air point and the third intercostal space, external border, where S1 and S2 can be heard. And then the fourth one, which is the tricuspid. This is located in the fourth intercostal space, external border. And the fifth one, which is in the fifth middle clavicular, I will find the mitral, where S1 is the loudest. Can you breathe in and out? Okay, there is no abnormal sounds here either. Okay, can you please rest for me? When I'm here, I'm also going to check for your aortic, for any bruises here in the middle. Okay, perfect. I'm going to check for your abdominal area. It's divided in four. First, I'm going to observe before I can palpate. I'm going to be auscultating. I'm going to divide it in four, starting with the right lower quadrant. Then I'm gonna do the upper left quadrant. Sorry, right quadrant. And then I'm going to do the upper left quadrant. And then I'm gonna do the lower left quadrant. And I can hear all the bowel movement. The patient says that she have gone to the bathroom today before she come over here. They're doing one every 3 to 6 seconds. So that means that the patient is not constipating. She also is saying that she's urinating and there's no pain when urinating. Okay, when I'm here, I'm gonna be checking for your reflexes. So I'm gonna do radial, brachial. Okay. Here in this area, I'm going to do the popliteal here in the back. Here in the posterior tibial. And I'm also going to do the pedis dorsalis. Okay. Let me sit you out. Let me check over here, and then we complete this with the reflexes. Your both extremities are warm to the touch. There is no edema. There is no bone deformities. They look all nice. There is no venous there. They look super nice. Let me check also for the capillary refill. Okay, at 3 seconds. Capillary refills on both sides. And your fingers, capillary refills on both sides. All good. You can have a seat over here so I can check your reflexes. Brachioradialis, bicep, tricep, patellar, the Achilles, and the plantar in a J. Okay, so you can stand up for me. Okay, now can you go? Let me go against resistance. Okay, leave your hands against resistance. Now your arms against resistance. Put your arm up, down. Okay. Now can you walk up and down? Come back. So my patient is coordinated and balanced. Can you do the runs vertex for me? Okay. And she is balanced. Can you sit for a second so I can do the strength of your extremities? You do fit? Okay.